please.
Good afternoon and welcome to the Board of Health meeting of December 6, 2021. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's June 16, 2021 signing of an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of his March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, until April 1st, 2022, this meeting of the Chatham Board of Health is being conducted in person and via remote for public participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number 945-4410. Can I have the ID number? Sorry, the conference ID number is 376-381-447#, or join the meeting online via Microsoft Teams through the link in the proposed agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of the meeting on the town's website as soon as possible. I'd like to turn the meeting over to Chairman Beckley. You can have that.
Thank you, Judy. Let me note before we begin that we do have a quorum, so we are all set to start tonight's agenda. Let's start with item 1, which is a variance hearing for Jody Gleason at 353 Bridge Street. Dan Speakman. Is Dan here? I see him there. We don't hear you yet, Dan.
Can you hear me now?
We can hear you now, yes.
Okay.
Would you just introduce your request?
Okay, I'm going to read off the variances. My name is Dan Speakman. So we're requesting variances to maximize the distance from the Town of Chatham Regulation, Section 4.2, a variance of 24 feet requested from the 100-foot separation requirement from the SAS for a water course. The second one is a Town of Chatham Reg variance of 0.9 feet requested from the 5-foot separation requirement between the bottom of the leaching facility and the high groundwater. The third one is Town of Chatham Reg's variance of 7 feet from septic tank and 5 feet from SAS from the 10-foot separation requirement to the water pressure line. The fourth one is the Town of Chatham Reg Section 4.2 variance of 9 foot requested from the 20-foot separation requirement from the SAS to the foundation. And the fifth one is Title 5, Section 14.05 variance of 0.9 feet requested from the 5-foot separation requirement between the bottom of the leaching facility and the high groundwater. Number 6, Title 5, Section 14.05 variance of 7 feet from the septic tank and 5 feet from the SAS from the 10-foot separation requirement to the water pressure line. And number 7 is the Title 5, Section 14.405 variance of 10 feet requested from the 20-foot separation requirement from the SAS to the foundation. So those are the variances we're requesting.
Okay, and this is simply to upgrade the existing septic system at the property, which is an existing 4-bedroom house, and there's no proposal to do anything with the bedrooms or the house itself. True?
That's correct. This is a simple upgrade.
Okay. Judy, I have one question. In the variance request regarding the seasonal high groundwater, is there a reason that we don't simply raise the height of the field?
Dan could probably answer that, but my thought is probably they were trying to keep the profile as low as possible between the two buildings. And the type of chamber that they're using is approved for that type of a reduction.
Okay.
By the state. So that is considered a local upgrade approval, which we can do.
Okay.
Am I correct on that, Dan?
That's correct, Judy. We have issues with breakouts, so that lowering that unit down makes it easier on the breakout.
Okay. Board of Health questions? Dick?
I'm a little confused by this. In the letter from Judy, it says the applicant should restrict this property to a maximum of 5 bedrooms. Is this a 5-bedroom sized septic system? And if it is, then could it be a 4-bedroom system with a smaller leaching field? Why does it say 5
There's 5
bedrooms?
bedrooms because my understanding is the 5th bedroom is in the garage apartment. So there's 4,
Right.
there's 4 in the main house, and there's 1 in the garage apartment. But we do need, Dan, a
Oh, so
floor
this is
plan for
5
that garage apartment. We did not receive a floor plan for that.
Oh, I'm sorry about
So that
Yeah,
may be
here's
where
the-
some of the confusion is.
Yeah, that is a one-room apartment.
So on the, there's a bedroom on the first floor of the main house.
Yes.
But this variance has nothing to do with the number of bedrooms whatsoever, true?
No, they're not changing the existing number. So there's 4 in the main house, 1 in the garage studio apartment, and they're not doing any additions or upgrades to the dwelling.
Okay. So the variance requests basically are tied to the fact that this is an existing dwelling, there's only certain space to locate the replacement system, and these variances are required in order to fit that in there.
Correct.
Okay.
And I don't know, Dan broke all the variances out between the Title V and Town of Chatham. I combined them all in your memo, that's why you're only seeing 4 bullets,
Okay.
because they are the same variances, just, we have our separate regulation.
We have a recommendation from Judy to approve it with 3 conditions that are listed on her memo to us. Further Board of Health member questions?
So Judy, there's no, the location can't be improved to decrease the need for variances as far as you can tell. That's correct, is that correct?
It doesn't appear to be. I mean, they're pretty
Yeah.
much squeezed in between the 2 buildings. There really isn't any location in the front of the property. I don't see how they could, change it.
Yeah, and I just had one other question. How did the other system, did it fail, or why are they replacing the septic system, the owner?
It failed.
It failed.
Yeah, when they did the inspection, there were signs of hydraulic overload
A
in the
routine,
system.
a routine inspection?
An inspection for real estate transfer.
Or transfer,
Is it
okay.
a cesspool or a previous Title V?
It was an existing Title V, it looks like a leach field that was there. I don't have the
Right.
report.
Yes, it was.
Sorry, I don't have the
Okay.
report.
There was a leaching field there, Judy.
And it was failing?
So that leaching field, did they have variances for that leaching field, or that was a smaller leaching field?
It was an old field from the
didn't have-
1970s,
They didn't have these
if I
requirements.
remember correctly, so
Right.
it had been there a long time.
And an innovative system wouldn't solve this problem.
I mean, it wouldn't do, what do you mean by an innovative system?
An IA?
I mean, they could put one in if you were concerned about, the variances, but they'd still need the variances.
They would.
Yeah. I mean, the system was put in 1975.
So it
it's
wasn't even a Title V, it was that predating old design.
So Judy, these variances, I assume, fall within range of what we've done before in other similar situations?
Yeah, the state gives, I mentioned the local upgrade approval. They give you a list of things that you can vary for remedial use, from remedial systems. So taking a system that's failed, for an existing property, and these are the variances that you would give, and we have, of course, done them many times.
Okay, yeah, I don't,
And if they did this and the sewer came down Bridge Street, they would only have 1 year to connect. This isn't like an innovative alternative system.
They don't have plus 10 years,
So they
No.
would have to connect within 1
They
year.
would have to connect.
whenever.
Yeah. When the sewer comes, they'll be required to connect with whatever time frame the board gives them, which is right now a year. But
Can I get a motion to approve? Unless there's further discussion.
I'll make a motion that we approve the variances for the 353 Bridge Street application with the conditions that Judy has put forth, and maybe she can read them.
Yeah.
The applicant should restrict the property to a maximum of 5 bedrooms and record this restriction on the deed at the Barnstable County Register of Deeds. The applicant shall submit a copy of the executed deed restriction to the board. The engineer shall submit an engineered as-built plan, including as-built elevations, with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling will be allowed without further review by the board or its agent. And I would also request that we get a floor plan of the garage apartment as well, to include
Add
with
that
the
as number
packet.
4. Okay. Can I get a second? Any comment from the public before the board votes? Okay, I'd like to call the question. All in favor of the motion as made and seconded, say aye.
Aye.
Aye. Okay, motion carries, and the request is granted.
Thank you very much.
You're welcome. All right, item 2 on the agenda is a variance request from Real Estate Inspection Regulation for Jackson Smith at 739 Kroll Road. Attorney William Litchfield representing. Mr. Litchfield.
Good afternoon, Mr. Chairman, members of the board. Bill Litchfield here on behalf of Jackson Smith, who is the prospective buyer of this property. I first want to thank Mr. Speakman for setting the stage. He asked for either 7 or 4 variances, and I'm only looking for 1, so I appreciate his indulgence. We have a curious set of circumstances. The seller has declined to have an inspection, and the buyer is willing to do what needs to be done. But there have been a number of complications in this matter not relating to the real estate transfer regulation. We were originally under the impression that there was a cesspool. We understand that there is, in fact, a Title V was designed and installed sometime in the 1990s. We are simply asking for a variance from the requirement of inspection prior to closing. This is not necessarily a case where the property is going to be demolished, which is why we don't fit precisely under Section 4.4 of the Real Estate Transfer Regulation. But I can assure you that if Mr. Smith buys the property, we will do what needs to be done. The property will not be occupied. If it is susceptible to rehabilitation, Mr. Smith proposes to rehabilitate it. May otherwise, and Judy has seen the property, it may not be habitable as it now stands. But if Mr. Smith buys the property, we will bring the property into compliance with the regulation. We're simply seeking to do so after the closing rather than before.
Thank you. The board has a recommendation from Judy that we approve this request with the condition that the water service be shut off and that the system upgraded or inspected prior to occupancy of the property, both of which I think are reasonable. I like the idea of officially turning the water off because that avoids any temptation to use the property until it's really ready to be reoccupied. Questions or comments from board members?
I have one. Judy, is this the house that they had a lot of stuff in their yard and a big?
They used to,
They used to, yeah. I
Yes.
live right around the corner from that, so I know
yes.
where it is. And that's
Yep.
all been cleaned up. And that's the-
Yeah, I mean, this house has been one of our problem properties for years
Yes.
now. We've gotten complaints regularly. about the collection of debris in the yard. The last time I was up there with the building inspector, the house was, I mean, it's been vacant, as far as I can tell, for years. It's in very poor condition. I don't think it's habitable, but, you know, who knows? Someone could try and live there, so.
It'll be a real
It's,
benefit to
yeah.
the community that this be sold and brought up to code.
yeah.
But I'd like to make a motion that we approve this
Okay?
on the property
With the
with the
conditions,
conditions as stated.
water service be shut off?
Yep. And, yeah, the water system being shut off.
Okay.
Now, do we give her a period of time on this? Do we give them a period of time to get?
I think it's whatever their time,
It's just going to sit there until they're ready?
once that we have an assurance that the property cannot be occupied,
Yeah.
I think it's up to them.
Okay, very good. Thank you.
We have a second.
Well, I would second. I have a question. Is shutting off the water the same as us saying that the house will not be occupied or used? Or should that be a separate,
I would say those are two separate, you could be considered two separate things.
So maybe we amend the motion to say not only water be
yeah, okay.
shut off officially, but the property not be occupied until,
And then that the property not be occupied until a reapplication for the septic is made.
Yep.
so that's the amended motion. And that's your
If I could,
second.
If I could, Mr. Chairman, briefly, Bill Litchfield, if we have the system inspected and it passes or is brought up to code or to requirements, that might sort of complicate the matter. If the motion is that it not be lived in until there's further review by the board, that might not be necessary if the system passes or can be improved.
We essentially say in this recommendation that the service be shut off and the system upgraded or inspected prior to occupancy.
Right, so I think
So it
that,
can't be occupied.
Yes.
If we just leave it the way it's
so,
written.
so long as the recommendation, the motion includes that wording, to be shut off and the system upgraded or inspected prior to occupancy of the property, I think we've covered it.
That's fine, thank you.
Okay,
That's much better that way anyways.
all right, so we have a motion, we have a second. Anybody from the public wish to comment on this before the board votes? Okay, if not, all in favor of the motion, say aye.
Aye.
Aye. Any opposed? Hearing none, the motion is carried unanimously.
Thank you very much.
You're quite welcome. Okay, let's go to item number 3 on the agenda, which is a continuation of a show cause hearing regarding a sewer connection order for Patrick O'Brien at 4 Youngs Road. I know the board has received numerous update information on this case since the last meeting, and is Mr. O'Brien on the call?
Yes, I believe
I
so.
see,
Can you hear me?
yes. Okay, we hear you. We got your information, thank you. We got
Okay.
other additional information from the town
Engineer?
town engineer.
Yes,
I don't know where the Board of Health members are on this. I've been thinking about this issue since the last meeting. I've driven by the property 2 times. And having read the most recent report from the town engineer, makes me think that my preference is that we withdraw the order to connect, because it's not totally clear to me that a gravity connection is assured on the Barn Hill Road hub or stub. But we do know that the applicant, not the applicant, that the owner does have pretty well-established hardships associated with making this connection all the way across his front lawn and up the hill. So that's my preference. I don't know let's have some other discussion from, And it seems to me, if you get into the big question of, well, what implication does this have, if any, for future corner lots? We did get some good information in the town engineer's comments that this is really a case-by-case situation, and their objective generally is to defer to what's easiest and most convenient for the property owner in these cases. And I think clearly in this case that that's the situation. If the owner defers or declines connecting optionally to Barnhill, and he wants to go with the Youngs Road whenever that is ready, then he's made his choice. And if he has to pump to get to Youngs Road, he'll pump. If not, he'll have the good fortune of a gravity feed. But what do other board members want to do here?
Now, are there stubs at both exits? There's not.
No. Youngs Road has not been planned
So
yet.
there's nothing there right now for him to snub
Nothing
into.
there, other than one stub.
Dead end, yeah, that's what I thought.
There is a stub that goes a little distance from Barnhill, several feet down Youngs Road, but it's just there for when the time comes.
What we did talk about last time. Thank you.
Yeah, I think that the engineer has sort of offered the opinion that he thinks it's a reasonable request, considering the circumstances, to allow him to hook up to Youngs Road eventually. And then he does sort of speak to precedents and says the town in general have tried to take into consideration connection of corner properties, and we have tried to accommodate desire to connect off a different street in order to try and minimize impact to the property owner. So I think this falls within the realm of that opinion. The big difference is the time it might be when he hooks up, but.
Correct, but he's got a, apparently we've got a seasonally used house, we've got a clearly
Functioning Title V.
functioning Title V system, so I don't see the environmental downside of giving him the opportunity to tie in at a later date. I do see in the report from the engineer that he does suggest, Judy, those two, something about updating the documentation. I'm not quite sure what that means. But also that the property owner should sign off on the fact that they are not guaranteed a gravity connection in the future.
Yeah, that would, if you decide to take the order away, that would be what we would do. We would let the water, the sewer company know that this has been taken off the table for now. And we would also send Mr. O'Brien a letter stating that it, that.
You'd like to have a note from him?
Well, I would just say that, it's your responsibility, and.
Irrespective of
And with
gravity,
the
okay.
understanding that the system has not been designed for Youngs Road, and there may or may not be a,
Okay.
possibility for a gravity fit. I think he's pretty aware of that at this point in the discussion.
So, can I get a motion? The motion would read something to the effect that you hereby move that the connection order previously issued to this property be rescinded, and that Judy send a communication to the water, WPCF.
Well, he's saying the water pollution control facility, but I would. He's saying the water pollution control facility, but I would send it to Tom Temple, who's the
Okay, to Tom
DPW
Temple,
director.
and that you would send a letter to the property owner clarifying
That we rescinded the order and that he's responsible for connection on Youngs Road, whether it's gravity or a pump system.
so we can get a motion to that effect?
So the information we have here that says no mechanical components installed, tanks, grinders, pumps, et cetera, no electric, that may well not be valid. Because if this is going to be a pressurized line coming up Youngs Road, they're going to need to pump into it.
Yes.
But still, he won't have to tear up his entire front lawn
Right.
and all that, so.
Right.
I don't object any longer.
Yeah, so there's no, so I'll make a motion that we rescind the order for 4 Youngs Road to hook up to Barnhill Lane, and that we allow them to hook up to Youngs Road when that becomes available, and that the Tom Temple be notified of the town of that change, and that the property owner
Judy will send the
is made
property.
aware that the Youngs Road hookup may require a pump.
Right.
Is there anything for me to add there?
I think you covered it.
Okay.
Do I have a second? Ron, we have a second. Anybody wish to comment on this before the board votes? Okay, I'll call the question. All in favor of the motion, say aye.
Aye.
Any opposed? Hearing none, the motion is carried.
Thank you, Mr. O'Brien.
Thank you.
All right. Let's go to item 4 on the agenda, which is an update and a discussion regarding 32 Mill Hill Road. I know board members received a short memo in our packets. This update, Judy, we actually previously got in November. November 19th, I believe, was when we originally
Well,
got.
I think I just sent it to you after we had the staff meeting. I didn't send it to the full board.
Okay, but I've seen this before, and
Right.
it's like 2 weeks,
Right.
2 weeks
So
old.
about 2 weeks ago, the department heads, which I say in the memo, met, Jill, Tom Temple, and we discussed, how we're moving forward with this as far as how we're going to actually get the cleanup done, and if there's going to be money for it. Tom, he was pretty clear that he doesn't feel that he has the manpower, the equipment to do this himself, because it could be a little tricky, moving such materials safely and efficiently. So he has put it out to 3 contractors, and we're waiting. As far as I know at this point, I have not heard anything since we discussed it. We are waiting for his contractors to give us the estimates. He's estimating it could cost anywhere from $30,000 to $50,000 to clean this up, plus tipping fees and police duties. I did get a draft letter from town council that is ready to be sent out when we know we can move forward with a date. And as far as I know about the funding, we're still kind of up in the air with our finance director and Jill as to where the money's going to come from. So I have not gotten a positive response on that yet.
So this sort of sets us back to where we were 2 months ago. That nobody knows where, the town highway department doesn't feel they want to get involved and send a truck down there and just do this. And so now we're going to have to go to most likely to the town meeting next summer to find this money, because nobody's going to come out and offer $50,000
I
plus
don't know.
tipping fees to clean up 100 feet of,
Dick, I don't think it's that much money
well, it says $30,000 to $50,000.
yeah, I
plus
don't think
tipping
that's a
fees.
large enough amount of money that the town couldn't find that in the existing accounts, personally.
I mean, this is the amount of money that we were sort of estimating was going to be the whole project, including
No.
this property.
I think it's going to be much more to go down the hill.
Yeah.
And it's not just a matter of, bringing in the truck and load. I mean, there's all kinds of material stacked up, and it's right on the precipice of the hillside. We're afraid stuff will tumble down. We don't want to do any damage to his property. There's possibly hazardous materials mixed in. So Tom is just a little concerned that he just doesn't have the staff.
He was
burning stuff.
Ed Button.
Yeah, on Sunday. He was burning stuff, and where it was going, I can't find it. I drove around, but,
McGrath was burning?
yeah.
Well, I don't know.
Right on,
He could have been burning, he does have a lot of wood on the
8
property.
feet from the roads.
He does have a lot of wood, so he could be trying to move some
Well-
of that out.
Well, I'm disappointed we haven't heard by now as to the current plan to implement Phase 1 of our effort to get this property at least partially cleaned.
We've said that this is a hazard to navigation on that road.
Right.
That people, are in danger of having head-on collisions with trucks, and yet we continue to say, there's no way we can do this for months and months and months and months until somebody volunteers that they're going to give $30,000 or $50,000 out of their budget. It's just, it's terrible how slow this is going.
Yeah, it's noble. Yeah, Judy, I would say, what's the problem? What's the problem with the, I guess, the town manager and the finance director meeting and giving us the answer, they can find funding or they can't find funding? That seems like it should be pretty straightforward, but it's dragging on quite a bit, which leads me to think, as Dick has said, that they're probably, or there's a high possibility they're going to say we'll have to come to the town meeting. Now, to follow up on what Dick said, the board has gone out and said it's a nuisance. We've talked about it being a hazard in the roadway to the big trucks going back and forth, a hazard to pedestrians, children. The neighbors have been complaining. I'm not comfortable having the board make all those statements and then say, oh, yeah, we're okay with waiting 7 or 8 months till next July or August, middle of the summer, when it might get cleaned up. I'm not comfortable with that time period. I don't know how we get around it.
I agree.
But I don't think the Board of Health should be sitting saying it's okay that we wait that period of time. If that's what the town does, and I don't know all those things up there, but I think at the least, we would need a written statement from a person or an individual or an entity that's taking responsibility for the delay, understanding what we've said about the hazard. So that's kind of what I'm thinking.
I would also like to have the town attorney comment on, once we say this is a hazard, what's the liability of town if there's an accident in front of his property? If the town has to pay $5 million because somebody gets into a head-on collision with a dump truck, they're going to be upset that they didn't spend $30,000 or $40,000 to clean it up.
I'd also like to know how much time Tom Temple thinks it will require to get back the quotes that he put out at least 2 weeks ago.
I think more than that, yeah.
And I'd also like to know what percentage of the roadway clearing could Tom Temple and the town and his town department do? Could they do 90% of it? And if there are certain tricky aspects that are beyond their capacities, then we get bids for those. But there's a lot of that cleanup. I think, should be within the scope of of his department, of the DPW.
I would also ask the question, suppose we are told we have to go to a town meeting with a warrant article, which, does it take a 2/3 majority to pass it? And the town says no. What are we, as a board, what would we do? Say, oh, we're just going to forget about it? Obviously not. So that whole process doesn't seem quite right to me. And I also go back to originally in June, when we took on this problem for the town, we were presented that it would be a very straightforward way to do it using the nuisance ordinance, and we took it on. But now, as things evolve, we're finding out that it's very difficult for us to do it. So it makes me rethink the whole rationale for why the board took this on.
It's a difficult situation.
But I
I
come
wish I
back-
had the answers for you. I
I-
know
I-
that even with the nuisance ordinance, I mean, the next step is to go to court, and I don't know how much faster that would be at this point to actually get him to clean it up. That's why we decided if we could at least get the roadway cleared up with town funds, we would move.
No, I
Makes
agree.
more
It's-
sense, but how, then we have to proceed forthwith to do that.
Right,
It's a two-part project now. The roadway first,
yep.
and then deal with the rest of the lot. But I also would say, I'm addressing these questions to Judy, but Judy is just a conduit. You're
Right.
just passing information back and forth. It's not you making these decisions, so. But these are the questions I have. And I'm surprised the town can't find funding to do that small thing, to clean up this.
I mean, they haven't-
This thing that's a hazard right now.
She hasn't said that they can't find it, they just, at this point, have not pinpointed it.
Yeah,
Well, did-
I'm not
did anybody
an
else-
expert with the town things, but it seems like they can give us a yes or no.
I saw an article in the newspaper not long ago commenting that the town of Chatham was flushed with funds.
It's budget stuff.
Right, and this money, it's not like this is money that isn't going to get paid back. This money is going to end up a lien on his property.
Right.
It's not an expenditure of town funds that we're donating to Mr. McGrath. The town is going to recoup this money,
Right.
from him at some point. So it's just bizarre that somebody can't figure out a way to expedite this.
I also agree with what John said, that, I mean, I'm not an expert and I don't know their manpower and their vehicles and all, but I'm surprised that the DPW isn't able to do this with effort. It's not easy. Nobody wants to do it. And I can understand why it's not something he's eager to do, but I'm not sure with the limited amount I know that I understand that he can't do it. Tom Temple runs the transfer station as well.
I mean, I'd be happy to ask him to come to speak to you. I mean, he made it clear to us when we were out there that this was very complicated and that he needed to have pickers and equipment to pick things and move them and to safely move these piles of metal. I'm not an expert at this, so.
But, I mean, the transfer station deals with, they have a scrap metal bin, they have a construction area, refuse area that has all kinds of junk in it. They take propane tanks, they take old fire extinguishers. They're dealing with a lot of tricky issues already. It seems like it's right up his alley.
Yeah, I just think because of the way
me,
this stuff is all piled together,
I know, yeah.
it's not, at the transfer station, stuff is separated into piles and things are brought in
But I do
singularly.
think we need to do more to push the issue, so maybe Tom
Yeah,
Temple
and I
needs to
agree.
come.
I mean, maybe,
Maybe the attorney again, have an explanation as to why we can't get a yes or no on the financing. And I would just speak for myself, telling us we have to wait for town meeting for another 7 or 8 months just doesn't seem reasonable with what we've already said about the problem.
So I think
It may be that's all we can do, but
So I think it's very clear from the discussions we've had, Judy, that the Board of Health is very concerned about this dragging on for weeks or months into the future. We would really like to request in a more urgent way that the town officials involved in this give this a greater priority.
I can,
You okay with that? Everybody okay with that?
I say one thing, the thing that bothers me is we have said it's a hazard, correct?
Right.
If something happens in this long period of time,
Right.
who's going to be responsible?
right.
Board of Health?
Suppose there's an injured child on a bike or something.
Yeah, I mean, there's so much that could
You don't
happen.
want to
Yeah.
think about that, but, you have to keep a focus on this, I guess, a prevention focus if we can. All right.
We can, I mean, I could put together a memo again to the Board of
From
Selectmen
us.
and from the board.
Reiterating these various,
Reiterating-
why don't we do that, just to get on the record, okay?
what kind of letter, Judy, did you say?
A memo or a letter to the Board of Selectmen and the town manager and the.
And then CC
and
Tom
everybody.
Temple and
We
CC.
need
See everyone.
answers. And if the answer is, we have to go to town meeting, they can't do it now, we need it in writing from the entity, the person who is taking responsibility for that delay. It shouldn't be on us as a board, because I think we're clear what we want to do. I think.
Okay. Yes, public comment, please come up to the microphone. Please identify yourself. I think you've done this before.
Oh, I think so. Carol Gordon, South Chatham. Once again, I appreciate the energy of this board for this project, but also I found that, when projects don't have a beginning and an end, they totally remain open-ended and nothing gets done. And you can see that this has happened now for 10 years. And it feels like we're getting close, and then we get pushed back because of different, just people bring up different things that have to be done that they can't possibly do. I love the idea of having DPW come in and clean up what they can and bid, and then take whatever else we need to pay. It seems like the town has money for everything else, for other airport commissions, consultants, things like this, but we need to have some money so that we can protect the citizens of Chatham from the hazardous waste and this whole Mill Hill Road thing. And isn't it the charge of DPW to keep our roads clean? Isn't that what they're here for, to do? I mean, I don't understand why we keep getting all these roadblocks in our way. And I just feel that we need to put dates on things, and we need to have accountability, and we need parameters. And we should have the bids. There's been, 3 weeks to get the bids? Okay, the bids are in. Pick one, have the expenses, put a date on it. And we said we had the emergency fund. Jill has a slush fund. The money should be there. I mean, do we have to do a GoFundMe page to get Chatham to clean this up? I mean, really? That's a little embarrassing. So anyway, you know how I feel. And the neighbors try to call DPW. They take no calls. They refer everyone to poor Judy. And so they're not taking calls from neighbors. They're just kind of stonewalling everything. And, people are just really, really upset. It's been way, way too long. And winter's going to be coming. And town meeting is just, don't even think about it. I'm sure that there will be lawsuits if it goes to town meeting. I mean, that's just way too long. So thank you. Please keep pushing ahead. Please keep asking for specifics, and maybe let's try to get this done. Be great if we could get something cleaned up before winter. Thank you.
Thank you.
Can I just say, the town manager is the boss. The town manager is the boss of the DPW. The town manager needs to tell the BTW, she doesn't want to hear why they don't want to do it, why they can't do it. She wants them to do it, and she wants to do it within a month. End of story.
Thank you.
That she has to stand up and take responsibility and do it. It's easy for the DPW to say, well, that's not something we normally do, and we really don't want to do it, and we don't want to have to rent a piece of equipment that we don't have, or we don't want to take our gigantic front-end loader out of the transfer station and drive it a mile down the road and clean this thing up. I don't know. It's crazy. The town manager needs to deal with it. Now, Mr. McGrath has a lot of friends in town, and a lot of people may be unwilling to really want to do things. That's not acceptable. This is a dangerous situation. We've said that. Town manager needs to do something about it.
Okay, thank you. Judy, if you can add to that letter you're sending a request that you said that Mr. Temple be asked to come to an upcoming Board of Health meeting so we can talk with him directly about timing and capacity. We'll add that in.
Or maybe we should ask the town manager to come here and explain why she can't expedite this.
You want to do that? Okay.
You can,
Judy, is that
you can
something that-
ask, I can put that out there and ask that they both attend and update the Board of Health on where we're at.
Okay. All right, fair enough. All right. Thank you, Judy. Moving along. Let's go to item 5, Chatham water quality. Do we have any updates on that to speak of?
As you know, Bob is on vacation. I have not heard any updates, so I really don't have anything. I do know that they're waiting to put bids out on some of the work that they've planned on the wells for February and March. They're going to be putting it out to bid, so that's all I know.
All right.
For wells 10 and 16, I guess, the new wells that they're going to be developing.
Okay.
But I don't have any, I'm sorry, I don't have any other updates for you.
Okay. All right, let's move on to item 6, which is a discussion on COVID-19. You have any updated data for us?
I do.
I know we read the local press, and I think we're all getting the sense that things are growing in terms of case reports and positivity.
Yeah, so as of today, since the beginning of time, we've got a total of 457 cases in Chatham. For December, so far this December, we've had 8 cases, confirmed cases. 6 of them were in vaccinated people, 2 were non-vaxxed. Our incidence rate is up to 28.2%, and that's up from 23.3 last week. Our positivity rate is up to 7.0, up from 5.37 last week.
And that's the number of tests that are positive?
Yes, that's the percentage of positive tests.
Okay, so that went from
The
5
incidence,
to,
it went from 5.37 to 7. It's been going up every week for the past,
okay,
3 or 4 weeks consistently. Those are a 2-week
intervals.
time periods.
Okay,
So it's not the most accurate, up-to-date, but that's how the state does it. So it would have been
Right.
2 weeks prior to December 2nd. And the positivity rate, the incident rate is the percent per 1,000
okay.
population. The Barnstable County positivity rate right now is 6.67, and the incident rate is 37.2. I really think the incident rate is probably the most important number from an epidemiological standpoint. And we are, we're high at 23.3, but we are below what the Barnstable County's rate
I
is.
think that's, if I'm not wrong, the incidence rate is expressed as the number of residents per 100,000 population
Right.
in new
What I
case
said,
reports.
1,000,
New
yes.
case reports, but it's benchmarked on a population basis of 100,000. So you
Right.
can compare one county to another county, or one town to another
Correct.
county. Okay.
As of last week, we had, 32 beds in the Cape Cod hospitals. That includes Falmouth Hospital, occupied, 2 people in the ICU. 6% of our ICU beds are occupied right now.
6. That's
Yes,
great.
6%. So right now, I'm still working on getting the booster shots out to the homebound. I think we finally got it scheduled for December 17th with the EMTs in Chatham. Outer Cape Health, we're going to be doing about 15 homebound people scheduled for that. So that's good, and we also have, on the 17th, scheduled a clinic at Chatham Elementary School for our 5 to 11-year-olds. And I urge our families out there to register for that. They can find the link by contacting the health department. I'll put it on our website. I don't believe I have yet, so there is a link where you can register for that. They can call the health department, and we can help them with that as well. Omicron variant, as you know, is here. It's in Massachusetts. It's in the United States. We knew it was coming. It's got more mutations than the Delta. They don't know a lot about it. There's still a lot of questions. So, but it is something of concern. So we're keeping an eye on that. And really, the best defense is the thing we've been doing all along, is masking up, getting your vaccine, getting your booster shots, good hand hygiene, and monitoring your health and staying home if you're sick. I also urge people over the holidays to do home testing before you go to gatherings, because if you have children there that aren't vaccinated, that will help you to keep that spread down. It's pretty easy to get these tests now. They cost about $23, and hopefully that price is going to drop because the feds are going to be supplying a lot more to those to our communities in the future. So that's all I have right now. It's not looking as good as we would like it to look. And unfortunately, over the holidays, I think it may get slightly worse. But if people do what they need to do, get vaccinated, get their booster shots, we're hoping we can stem this a little bit. So,
Any comments or questions on COVID update?
I got one question. Has Bob come up with any other ideas that we should be looking into to do? Or stay the status quo that we're at now?
Bob's been away for a couple of weeks, so we really haven't talked about it. Right now, as you know, we do require masks in town buildings when we have gatherings of 2 or more. We did have some discussion earlier about community center gatherings. We may need to do a little bit more clarification on that as to what people should be wearing their masks and what groupings.
Okay.
In any meetings at the town. Whenever anybody comes into the town hall and we sit down, we make people wear a mask. So
But
we
I
just
think-
need to clarify that.
But it's important that the signage posted on the entrance doors to the town buildings be consistent with the current mask mandate
Right,
issued by the Board of Health regarding those
yes.
Those
We
town
will-
buildings.
I will,
Okay.
I will make sure that gets clarified.
Okay.
We haven't discussed any other, more formal mask mandates around town. I don't know that many of the towns are doing it. There's a few that are talking about doing townwide mask mandates for any public areas, but I can't give you an exact number of what towns are doing it. Or whether I'm not sure whether I think it's necessary or not. It's a tough call at this point.
Yeah. Stay tuned,
It-
right?
Yeah, it is a tough call because everybody's tired of these requirements. But the bottom line is, in the Northeast and the Midwest, there is a surge coming. It's only Delta variant now, but we have Omicron is already here. It's going to spread faster than Delta. May not be more virulent, but it's going to spread. And so I would guess that by the new year, we're going to be having many, many cases of COVID. And it's interesting that in the data today, about 60% are in fully vaccinated people, not necessarily boosted people, but vaccinated people. So people who come and say, well, we've all had vaccinations and so we're bulletproof, that's not valid. And even though you may not get very sick, although vaccinated people are getting sick and going into the ICU, about 10% of the people in the ICU on respirators are now vaccinated. You do spread the disease if you're vaccinated and are positive, and you can bring it home to unvaccinated children and grandchildren. And so we need to be aware that things are getting worse.
I would say that we are seeing good numbers of getting the children vaccinated. Very high percentages of the kids on Cape Cod have gotten their first vax.
Good.
And I think that's going to help stem the spread a little bit. I think right now what we are seeing is a lot of cases coming from the schools and spreading back out to family members. So I'm hoping as we get more kids vaccinated and more people getting their booster shots, that will help. And that's...
And I know the schools, at least where my daughter goes to high school, they're doing pretty good pool testing every week. And when they get a positive in a pool, they're running down the individual students and having retests. And recently, the retest didn't solve the problem, so then they cut a deal with outer Cape Health Services, and the kids, including my daughter, were told to go over there and get a PCR drive-through test. So the point is, there is the capacity in the schools to respond to these cases that do pop up.
I can't say enough for the school nurses, Marmoy
be
school
doing a very
nurses.
good
All the school nurses on Cape Cod are working overtime. They're doing upwards to 50 to 80 tests every morning because there's a test and stay. If you're a close contact, you can stay in school if you do a antigen test in the morning. So it's been a little crazy for them, but they're pulling it off. They're doing it. They're working really hard.
Yep.
And we try and keep in touch with them and help them as much as we can.
Yeah, the problem is that if you're exposed today and you're tested tomorrow and are negative,
Right.
it doesn't mean you're safe. And the people that live across the street from me here have kids that are in Sudbury and in school, and this is exactly what happened. They went to a birthday party. Somebody in the birthday party was positive. Then they all went in and got tested. They were all negative. They got tested the next day and they were negative. So they let them go back to school. And then 2 days later, the whole class is positive.
Oh.
Because the test, you
Lab.
have to do the test every day for 5 days to know that,
It's a true, it's a
because it
true
may take
negative.
4 or 5 days for the test.
And I
to be
tell people
positive.
that all the time. I'm like, you need to test on day 3 through 5.
Yeah.
Okay, that's a very good point.
Because the next day is, you don't have enough viral
Almost
load.
pointless to do a test.
Yeah, you really
following
need to
day.
wait till at least day 3, they say, with the Delta. They used to say day 5, now they're saying 3 to 5.
And now these tests cost about $12 each if you go to the CVS and buy a packet of
Right.
tests.
$23.
You can spend hundreds and hundreds and hundreds of dollars on tests. If you have a family of 4 and you're testing every day, the money adds up. And a lot of people can't afford that.
Well, the schools do have a supply of them, and they're using their state supply
Okay,
in the school system, so.
Yeah.
all right, good. Any other questions or comments on COVID? Otherwise,
Comment.
Oh, I
yes.
think,
This couldn't be the same Carol Gordon we saw before, could it?
Yeah. No. I was here last time. Good evening. Name is Leslie Gillis, and I'm here for myself. I have a couple of questions. First of all, you spoke about the inconsistencies of the mandate for wearing a mask. And when I was here last time, I brought up the fact that on your front door, it says if you're vaccinated, you don't need to wear a mask. That sign is still there. My first question is, why is the community center different from the other town buildings?
the community center is not different from the other town building. If you, the rule that the Board of Health put into place was that any meetings of 2 or more people would require you to wear a mask in the town building. So the community center, we included the gym and the workout center, and then all the gatherings that they have in the public meeting rooms there.
Okay, but your sign here doesn't say that, still doesn't say that, as of
Our
tonight.
signs don't say that because if people come in to do everyday business, they're not required to wear a mask. If they come up to the counter to just get a permit or something, it's not considered a meeting, they're here for less than 5 minutes, they come and go. If they come into one of our meeting spaces to meet with me, there's 2 or 3 of us in a meeting, or even just 2 of us, I ask them to wear a mask, and that's what we require.
Okay, so what is the number again for the number of people sitting around? Like
2
if a
or
group-
more. So a meeting, which you have to have at least 2 people for a meeting, so yeah, 2.
Okay, and if they're eating, is the requirement is that they don't have to have the mask on if they're eating? I'm thinking of a group of women getting together for a meeting this coming week, and they're going to have lunch at the meeting. There's going to be about 78 people there with the windows all wide open. Can they obviously take their masks off to eat?
I mean, that's been the consensus of the state for restaurants and such, so I would assume we would allow that. But when people aren't eating or not partaking in a meal, they should have their masks on.
What about singing?
Yeah, I think they should wear their masks if they're singing.
And on the eating, let me just add this detail. That doesn't mean you can walk around and visit with people while you're eating a donut.
Should be sitting down.
You should be sitting down in your location. that's, as separated from others as you reasonably can, and then you eat or drink your beverage, and then you put your mask back on.
So if that's the situation, then why am I allowed to go to every restaurant on Main Street, which I do several times a week, and those mandates aren't there? I'm just confused as to why there's certain mandates in certain places.
I think we went over this last time. I mean, this was a town,
Request.
a request on a.
By whom? By whom? Who requested this?
Town board, committee members, and town employees requested that for town meetings, that this be put into place in order for us to feel comfortable gathering in person. That's why we do hybrid, because there are people who aren't comfortable coming into these meetings, but we want people to feel comfortable, so we're requiring that everyone wear a mask.
Are the employees of Chatham required to be vaccinated?
No, they're not.
Does that have something to do with this mandate?
No.
It's nothing to do with this
No,
mandate.
nothing to do.
Doesn't have anything to do with it?
No.
No.
Okay, so a room full of vaccinated people with their boosters still have to wear a mask
That's true.
You know the
That's the
answer.
current,
here in Chatham. Harwich, it's optional, community center and
We
optional,
had
and
this
their numbers are a lot higher than ours. It's optional. I called there, it's optional.
It's fine. This is what the board has decided. When we do review it every week, or every time we meet, every 2 weeks. Our numbers are not getting better, they're getting worse, and our data's showing us that 60 to 80% of our cases are in vaccinated people. So, the board has not gone so far as to require masks in all public spaces, for many of the reasons is that people are, they're tired of it, and we understand that. But for our employees and our safety of our town people coming into our town spaces, we are requiring masks.
Okay. And that's going to be probably the case going forward for probably the next couple of years, I would think, because it's going to be around, they're telling us, for a couple of years, right?
I have no idea.
Can't predict the future.
Okay, thank you.
Thank you. Okay.
One thing I would like to comment on is that you're right, the signage is inconsistent, and we need to get the signage more consistent. There should be signs on the doors coming into these meeting rooms saying, in this meeting room, you must wear a mask. And the sign on the community center needs to be changed, because the sign on the community center says masks must be worn in the gymnasium and the fitness center and at town meetings. That needs to be changed. It needs to say, and in the meeting rooms for any gathering of more than 2 people.
I agree, and it may be confusing to people, and we will work on that, get that clarified.
It should be standard wording and posting
Right.
everywhere, right? Okay.
Do we need this, do I say anything about this Skyway letter that was in our packet? It says you're hereby ordered to connect the building at 150
We heard that
Skyway
at the last meeting.
within 365 days, and then on the other piece of paper, it says within 6 months.
No, we don't need to act on that.
We don't need this.
We actually already did, that was one of our
'Cause
hearings.
This was in the packet that I got for this one.
It was just informational.
Okay.
All right, let's move on. We do have one set of minutes for November 15th that we need to approve. Does anybody have any edits or corrections for the wording that's in our draft November 15th minutes? Hearing none, can I have a motion to accept the minutes of November 15th? Motion. Can I get a second? Okay. All in favor of accepting the minutes of November 15th as provided, say aye.
Aye.
Any opposed? Motion carries. That's it for the agenda for tonight. Does anybody have any last-minute issues or concerns they want to raise? If not, can I get a motion to adjourn the meeting?
Motion to adjourn.
How about a second?
Second?
All in favor of adjourning the meeting, say aye.
Aye.
Any opposed? Okay, ladies and gentlemen, thank you very much. Our